aim for these conferences was that it's the idea that it takes a village to raise a child. We need all of the community to find and help children affected by parental alcohol use.
My research has found that parental alcohol use at harmful levels, which is below the diagnostic threshold for dependence, also has an impact upon children and is associated with adversity. So as such, it's important that we intervene early in order to prevent harms to both the parent and also to the child. So I think one of the difficulties is practitioners are often worried about asking parents about their alcohol use for fear of being perceived to be judgmental or critical.
The parents really felt that actually the practitioner who they had a relationship with was absolutely the right person to ask the questions of them, rather than being referred on to a specialist who they don't have a relationship with. The relationship is the work. The relationship is the thing that brings about change, rather than the clever things that you see. Another theme was the fact that if practitioners didn't ask or didn't show concern, then actually not only was that a missed opportunity, but it actually felt like it had a detrimental effect on the relationship. One of the parents talked to me about the worker who she had a very good relationship with, walking up a path past a recycling bin and going, have you been having a party? And just that one line made her reflect upon her drinking, and just seeing her own drinking through the eyes of somebody who she respected helped her to reflect upon it and really think, actually, if this person who I value thinks that that might be a little bit too much, then maybe it is. Maybe I need to do something about it. The other thing that was really clear from this research was just how important children are within the intervention. And whilst the intervention doesn't involve the child directly, what it does do is it gets the voice implicitly within the intervention by helping the parent to see their alcohol use potentially from somebody else's point of view. For some parents it's more difficult than others, life is more difficult, but actually, you know, parents do what they can, they struggle through to do the best that they can for their children. If we don't recognise that, if we don't build upon the strengths that exist in the family, then what happens is that the people who we're trying to engage with become much more defensive.
If there was one thing you wanted us to go away from today from your presentation, what would it be?
To be more curious about the reasons why things are presenting themselves in the way in which they are. So thinking behind the behaviour and actually thinking about the cause. There are 1.25 million children living in households where one parent reports relationship distress. That's a big figure, and it's one of the reasons why this programme is in existence, to actually make those children's lives better now, but equally provide them with the foundation for making their lives better in the future. We've partnered with the Early Intervention Foundation, who've helped us build the evidence base, and they host a website called reducingparentalconflict.eif.org.uk, and that hosts all of the documentation about our programme.
How can we help families to be able to think differently about the way they respond to their children, about the way they respond to one another? Haringey's Resilience Wheel focuses on the areas of safety, belonging, achieving, empowerment, purpose and adventure. What we know is that children with lived experience of alcohol, what happens is that it creates stress on the body and the brain, and that really impacts on the way we're able to think and how we concentrate, to help them to feel that they're empowered so that they're able to have choices in their lives and that they feel that people listen to them.
So the Insightful Families team, based at Insight Platform, which is our children and young people substance misuse service, is an amazing partnership between Adfam, who work with the significant other, the non-drinkers in the family, alongside Humankind, who are working directly with both the children and the families.
So my name's Alice Campbell. I'm a senior practitioner working at Insightful Families. We're looking at the whole family, so we're taking a whole family approach to support and strengthen family cohesion and resilience. We really are aiming to start conversations around alcohol use with families and professionals, letting families know that there is support out there for each family member, not just the parent that's using alcohol, but children, young people and family, friends and significant others. So we know that there are over 1,000 children in Haringey living with an alcohol dependent parent, and those parents aren't accessing any kind of treatment. For those parents misusing alcohol, we can handhold them to the adult alcohol treatment service, which is HAGA, if they're not already engaging. We offer one-to-one support, we have a parenting programme and we have a parent and toddler group. And the aim is that no parent will be excluded from accessing the service. We also work with schools within the borough, so we're able to see children and young people at school for one-to-one support as well.
So my name's Emily Miller and I'm a family support coordinator for Adfam. So the two main aspects of my role are peer support and family activities, both for significant others. Significant other in this situation would be the non-using family member that may be supporting somebody who may or may not be in recovery. By supporting the significant other, the chances of a sustained positive recovery are much higher because the family member is more likely to have more awareness and more understanding, more empathy, more personal resilience. People will say to us, what are the signs or how do I notice it? And it's a very hard question. We don't know what's going on underneath, and that's where we need to do that work and build that relationship to sort of make that child, family member, significant other, whoever it is, feel safe enough to say to us, actually this is what's going on and this is what I need help with. You can refer into Insight Platform and you can call us up and just have a chat.
Well, it's going to be a really positive step in encouraging families to not normalise alcohol use and therefore not normalise it for the children when they grow up.
Definitely know now where I can go to get some more support for families. Definitely be able to signpost families to get additional support. I think definitely for our children's centres, we can work in partnership with this organisation.
I really love what I do, and I know it means a lot to me, but it means a lot to the families as well. This works. It can be 2 minutes of a really good couple of words that can flick a switch and, you know, sometimes make a change.
After watching this film, I really want to get across the message that you can pick up the phone and speak to the Insightful Families team about anybody in the family that you're worried about. It doesn't have to be the dependent drinker. We're there to help the significant others and the children as well.